Hello, and welcome to Community Difference Makers, brought to you by Bankers Trust and United Way of Central Iowa. I'm your host, Emily Abbas, and this season we're teaming up with United Way to take a closer look at the issues shaping everyday life in our region. We've looked at food insecurity, access to childcare, housing, and youth violence. Today, we're talking about how youth violence and engagement show up in Des Moines and about how Safe and Thriving Youth, which is a collaborative effort working toward long-term solutions, is making an impact. When youth violence makes headlines, it can feel sudden, it can feel isolating, but the truth is, it's connected to deeper systems: education, economic opportunity, mental health, housing stability, and community connection. We'll look beneath the surface at what's driving it and what's working, what's really making a difference. Joining us today are three leaders who are deeply engaged in this work: Mary Sellers, president of United Way of Central Iowa; Jaquie Easley McGhee, Health Equity and Human Impact Regional Director for Mercy One. Did I get that right, Jaquie?
Yes, you did.
Okay. And my friend Bridget Cravens-Neely, who is CEO of Big Brothers Big Sisters of Central Iowa. Thank you all for being here. I look forward to our conversation. Should we jump right in?
Absolutely.
All right, Jaquie, we're going to start with you. Please kick us off by telling us how you all started working together to address youth engagement and youth violence. I understand you were personally instrumental in getting United Way involved in the issue. Tell us about what was happening at the time and why you thought United Way should play a role.
Well, thank you, Emily. And of course, everything is done as a team. So my personal involvement was being able to find and collaborate the wonderful partners that we work with. Unfortunately, Central Iowa is not immune to the gun violence that has occurred throughout our country through the last, through several years. And here in Central Iowa, sadly, about 3 years ago, there were back-to-back incidents of gun-related violence at our schools and or in areas close to schools. And so we felt that we had already, or I had already worked with some of the United Way team during our previous crisis called the pandemic. And so we already knew how outreach was important in this community and particularly bringing together the right players. So we invited some community leaders to join us at Corinthian Baptist Church, which happens to be my home church. And there, on the initial kickoff meeting, we discussed what ways in our various roles could we, and some were very non-traditional roles. You had the usual, you've named them: education, law enforcement, and social services. But we also dug deeper into many nonprofit organizations that also had an impact or an imprint with young people, because that outreach was critical. Being able to address the issue at its roots and then having something that is sustainable for this community. So thanks to Mary Sellers, who provided this foundation, and the staff and resources through United Way, and then many, many engaged community members like Bridget Cravens-Neely from the nonprofit world. This coalition, the Safe and Thriving Youth Coalition, still is motivated today to make a difference.
Mary, what factors did you consider as you and your team started to bring all of these stakeholders that Jaquie's explained to us together to start this initiative that would become what now we're calling Safe and Thriving Youth?
Well, it was interesting decision making at the time because United Way had never taken a primary role or a facilitator role or convener role when it comes to youth violence. But when we looked at the work that we had done around safe and thriving youth, so essential needs, early childhood success, education success, economic opportunity, and health and well-being, the foundation of why these kids might be the victim of someone picking up a gun or the ones that are picking up the gun had everything to do with United to Thrive. And that's when we stepped in. And we stepped in solely to be a convener. We are not experts. We're not closest to these kids. We just wanted to provide a space where people could come together. And, it was challenging at first. There was a lot of voices that we had to hear from, which we're really grateful that we did. But ultimately, we had to get alliance on what we were going to do systemically to move forward. Not saying that any individual program is good or bad, because we think they're all good, but we had to look at it from a broad based vantage point, which means the private sector, the public sector, the nonprofit sector, and those with lived
Mhm.
experience. So,
I'm glad you shared that background because now we use the word convener to describe you and your team and United Way of Central Iowa all the time. And it sounds like that was a first.
yeah.
Bridget, when did your nonprofit, Big Brothers Big Sisters, join the effort, and what perspective did you bring to the table?
So and thank you again for the invitation to be here today, to talk about this because it is something near and dear to my heart. Not just because of the work I do, but because advocating for youth and just being able to support and provide them with access and opportunities that they need to thrive is something that's been traditionally very, very personal for me. Um, I got involved at the convening at Corinthian Baptist Church that Jackie
Okay.
mentioned. That was my first invitation into the work that was being explored to figure out, first of all, what's the problem. So, Mary, thank you for what you mentioned about bringing the voices together, bringing the voices in the room. We probably had, what do you say, probably 50
Mm.
ish, about 50 ish different community leaders, all representing different organizations that either connected with youth, directly served youth, or were advocates for youth. Um, and what was so compelling for me is seeing all these adults in the room and one youth, one teenager who had been involved in some of the situations that were going on at the time around the community, around the city, and we collectively asked him to get up and speak. And the question we asked is, why are youth so angry? And his response was, we're not angry. We just don't know how to breathe. We're experiencing all of these different situations and circumstances, and we have no idea how to process them, how to find the right outlets to express how we're feeling. But most importantly, we just don't know how to breathe. So if you can think about that for a moment and make that real for yourself, is when you're sitting there and holding your breath, or if you're in a swimming pool or in the water and you have to hold your breath for so long, and that immediate escape that you're looking for when your breath starts to implode inside and you're about ready to start gasping for air. That's what I equated his statement to. And so from there, I actually started meeting with a couple of other leaders in the community who are very close to the population of youth who are engaging in these violent activities. And because I wanted to hear, I'm like, tell me what's going on. Tell me what's up. Give me the intel, give me the insight to be able to help me formulate this understanding so I'm not just making assumptions. And because we're a youth serving organization, it was important for me to start there because that's a huge focal point in being a mentor to a young person is you got to shut up and listen. And that was really the approach and the importance for me to be able to hear them, to understand before I just decided where let me fix. How are you going to fix something you don't know? How are you going to fix something you don't understand? How are you going to fix something if you don't have that insight, that input from the people who are living it each and every day? You have to hear and understand their why.
So, first bringing everyone together, then
Yes.
asking questions and listening. Jackie, what did you think of that process, or then what was next, even in the process of developing this violence reduction plan that then became the Safe and Thriving Youth Initiative?
The important thing, as Bridget said, is that we needed to listen to each other. Even the adults needed to listen to each other and be on the same page, almost in a pledge like situation that the end goal is that we all have the same desire to address this issue, and that in our various areas, which may have been siloed prior to this process, that we were going to work together. Now, through our United Way resources, we're able to hire a professional organization to facilitate those conversations. And I think we've spent about 12 to 18 months with the professional facilitator, which created a plan for us to work together as the various entities that we were, and then be able to hire our own individual to oversee the plan and make sure that the sustainability of our action and our goals were embedded in as we meet now regularly to discuss where we are.
Bridget, anything else that you want to mention that stood out for you in the process?
Yeah, and it was definitely a different process that I think a lot of us had not been through before. So the organization that helped us, and I should say, even though it was an organization, it was really two facilitators. One who was from this community and had many years of working with students in the Des Moines public school system, and then the other was an organization from another community within Iowa that had done the work and had seen the results because they had built and implemented the plan. And so what they did was initially, right off the bat, is reading the room and understanding we have to create sanctuary. And so, to Jackie's point, we spent 18 months 18 months, and the first 9 months of that was just creating sanctuary. So you think about 50 different organizations, all moving potentially in the same direction toward the same goal, but doing that vastly differently. And so being able to create that sanctuary so everybody left their own personal agendas at the door, everybody came in and focused exclusively and intentionally and passionately on solving this problem, which is helping our youth. We have to keep the youth as the focal point, because if we lose sight of them, this is going to just be another project that fails. Because of that sanctuary, we were able to create that space and maintain that intention so that we could continue to push forward. And what has come out of that, or what came out of that, excuse me, during the process was we were able to identify how each one of us fit into the puzzle. So if you think about this plan as a puzzle, everybody's bringing something to the table. Everybody has a specific skill set. Everybody has a specific ability, and everybody's contributing their ability and their skill set so that we don't have any empty pieces in the puzzle. And where we do find empty pieces, that's where we go out and we find that person, that organization, that resource to fill in the puzzle. That was what was so unique and different about this effort.
And I might lift up an example. Thank you for sharing the pieces of the puzzle. So I've been in healthcare for 20 years. And there have been several times, certainly during a pandemic, where our three large healthcare organizations have, worked together. But this was another unique example because our Polk County Public Health Department views gun violence among youth as a public health crisis, almost an epidemic, so to speak. And so our three major healthcare organizations looked for ways, or we were called to action, I would say, and came together under an initiative sponsored by Polk County Health Department and its former leader, Helen Eddy, in an initiative called Talk It Up, Lock It Up.
Mm.
And this is where, as our pediatric clinics generally ask anyway, Do you feel safe in your home? Do you have enough food? Is your housing stable? But in addition to those very important questions, we now ask in our PEDS clinics, is there a gun in the home?
Mm.
No judgment. I believe there's no judgment given when the answer is yes, but instead we provide free gun safety locks for our patients and their families. And has it made a difference? In the about same period of time, 3 years that we've been working together as public health organizations, the number of youth ages 0 to 18 that have presented to our emergency room departments due to gun-related incidents has decreased by 30%.
That's awesome.
Wow. Everything makes a difference.
Yes.
Mary, you often talk about youth violence as a systems issue. You mentioned that earlier, not just an individual, a family, or school. Explain what you mean by that.
So it's an issue that needs the entire community to come around it. And I think to Bridget's point, I think the reason that this took root and resonated is because it did take us 18 months,
Mm-hmm.
but everyone had a voice and there were people from all across the community, all different sectors. And that's the only way we're going to be able to address critical community issues. It's not up to a program, it's not up to an organization. It's going to take all of us. And I mean, I just want to say huge congratulations and thanks to those that initially were around the table and
Mm-hmm.
remain around the table,
Mm-hmm.
because this is not easy work to talk through this. We're sorting through a lot of data and misconceptions on
Mm-hmm.
who those kids are
Mm-hmm.
that might pick up a gun or be the
Mm-hmm.
victim.
Mm-hmm.
But the more education we can have and the broader we can look at this, the better off that it's going to be able to be sustainable.
And Jaquie, I'm glad you brought up the fact that this is looked at as youth violence is looked at as a public health issue. Many aspects of the violence reduction plan take that public health approach. Can you explain more about what that means?
Well, I know I've spoken several times about the way we reacted during the pandemic. This is really no different because when you look at a public health crisis, you look at all of the factors, socioeconomic, um, and how you can address those in terms of a public health reaction, much like we did for polio or much like we did for smoking cessation.
Mm.
All of those required education awareness of your physical, your emotional well-being. And so this is the same for looking at gun violence. And we've already really discussed all the important elements of making sure that we're listening, that we are providing the appropriate, and in some cases culturally appropriate responses. We've had situations where some of the groups who may previously have not connected on this issue have come together to find solutions. So when you're addressing public health, you are using the same kind of dynamics, but maybe for a different outcome. And so it was very, very important. And again, I applaud the leadership of our public health department to help us understand why we should view this as an epidemic as it is.
So let's move to root causes. Bridget, what issues tend to be underneath the surface or precede the violence?
Um, that's an awesome question. And I think we are still discovering at the core of it, we are learning that, or have learned, it has a lot to do with the social emotional wellness. There are a lot of impacts and a lot of outcomes and a lot of, dare I say, consequences after the pandemic. That isolation, our youth were starving, struggling. Some, not all. For some, it was great because they felt safe. But for others, it then became an issue of where do I fit in? Where do I belong? It kind of amplified it. Because here we have these youth who've been apart for 2 years, and now they're coming back together. there's a lot of change that can go on, especially depending on the stage of life that you're at. Are you in your childhood age? Are you in your adolescent age? Are you in that critical teen development age where excuse me, where you've now got to adapt to coming back in person with people who may have had access to you and still continue to bully. So I think a lot of it has to do with that emotional well-being. What we have discovered and what we have learned, and I'll say this is through the Safe and Thriving Youth research and work that we have been doing behind the scenes. And let me interrupt my thought for just a second and share that the work behind the scenes is still continuing, even though there may not be as much outward um, visible work. But there's a lot of work that's being done behind the scenes because we intentionally do not want to make the same mistakes that we've made in the past, which is throwing out a fix that doesn't even begin to address the core problem. So we're doing our homework behind the scenes to be able to understand exactly what you're talking about. And so again, our what we're finding is there's lots of different cells of where this violence is coming from. Jaquie mentioned cultural. There's also familial.
Mm.
There is also um, the uh, there is also the gang violence. There is also just natural beefs with people who are just different from you. It's all over the board. There is not one pocket, but all of it has manifest itself from simply that building of community and that sense of belonging, but not in necessarily the most healthy spaces and most safe spaces. A lot of these youth are looking for a place for stability, security, meaning I got your back, you got mine. Um, love, truly. If they're not getting it from home, if they're not getting it from school, they're going to find it somewhere. And the core of what we need to understand and what we've learned is these are basic human needs in addition to food, shelter, finances, medical care. That basic human need of needing to feel protected, needing to feel like you have a connection to another human being, and that human being cares about you just as much as you care about them. That's what I mean by social emotional.
Yeah.
Because if we don't figure that part out and how to reach them, the violence is going to continue and it's going to just perpetuate.
And might I add here that one important member of our coalition and partner in this behind the scenes is law enforcement.
Yep.
And throughout the length of our coalition tenure, we've, had everywhere from the Des Moines Police Chief to members of the street units that go out on the street. And a very important partner is our county attorney. And one of the interesting things that we've learned by having those individuals sit at the table with us is how there can be adjudication efforts that take place because, as we all have acknowledged, that we haven't eliminated violence or the feeling among some of our youth that they need to protect themselves. But at least our law enforcement is taking a view, as we've all three said, from the standpoint of the social emotional well being of these youngsters. And the Polk County attorney in specifically has created like an advisory relationship with many of these organizations that we've been talking about who are a part of our group, so that the county attorney's office can be not necessarily viewed as punitive ends, but as a supporting
Mm-hmm.
and a partner
Mm-hmm.
as we look at ways
Yeah.
to really support our youth. So we're really
Yes.
blessed to have the involvement of those law enforcement
Yeah.
agencies.
And they'll be part of this conversation in
Mm.
future episodes. So I'm glad you
Great.
brought that up.
Yeah, you can hear numbers
Yep.
from
And
them,
Chief
and yeah.
McTaggart will join as well. We talked, gosh, Bridget, you shared so much insight, and the emotional well-being part really sticks. But can trauma also play a role
Oh,
in
it's huge.
this?
Yeah.
It's huge. Um, if, for the listeners out there, if you're not familiar with ACEs, ACEs is a assessment and measurement of about the level of childhood trauma. All of us have had trauma in some shape
Mhm.
or form throughout our lives. How we've handled that, how we have managed that, how we have been able to self regulate or get the assistance and the support that we need and the resources to help us do those self management things that keep us away from the violent tendencies or expressing ourselves through violent tendencies. A lot of these youth just have not had that access. But ACEs is a true indication of not only the type of help that could be valuable and beneficial, but then also the degree to which they need that assistance. And so we hear today, and we've heard obviously over the last 5 years, more and more about neurodivergent conditions. And so with those neurodivergent conditions, some of those are it's a chemical imbalance. Some of those, it's just being able to teach those techniques, those self-help, self-regulating techniques to these young people so that they can be able to learn to navigate those traumas, understand those traumas, um, accept the feelings that they have because of those traumas, and then be able to evolve past them. That is something that is truly necessary and needed. But again, you gotta we have to be willing to take the time to pay attention to exactly that and really start asking, and this phrase has been shared quite a bit, and I heard it first from one of the biggest advocates in the community, Lewis Fountain, in conversation with him and in a presentation with him about understanding, stop asking what's wrong with our youth and start asking what happened to our youth to trigger and wake up this thing inside, this trauma or this inability to understand and recognize the trauma, and then wanting to express it in a way that's not healthy for them or healthy for the people around them.
And, in public health, since we've been talking about that, we now train, obviously, our behavioral health medical professionals, but all of our medical professionals on trauma informed care.
Hmm.
How do they treat youth who have experienced these adverse childhood events, ACEs, and how does that perpetuate in other aspects of their health? So, trauma informed care now is actually being taught as a science in medical school.
And I will say that a lot of your nonprofit organizations that directly serve youth have also adopted that training and that learning. When you think about mental health first aid, that's an actual certification. I've got members of my team who are certified in mental health first aid because they understand the importance and the impacts and the situations and the outcomes of what lack of trauma informed care and delivering the wrong type of care can do to a young person.
So important. Mary, throughout our conversations about these critical community issues, you've always done a great job of tying it back to United Way's United to Thrive framework. Would you do the same for us today when it comes to youth violence? How does that tie back?
Yeah. So, as I mentioned earlier, and I'll also just say, with Jaquie and Bridget's comments, ACE is also important to adults.
Absolutely.
You can tie it back to obesity, heart issues, diabetes. So it's important for all of us
Yes, it is.
to look at ACEs and see how we might overcome that. Um, but in terms of it tying back to United to Thrive, I would say that it fits squarely into what I opened my remarks with. Bridget talked about social and emotional aspects of these kids that aren't being met, but it's also the tangible aspects. Those are somewhat intangible, but
Mm-hmm.
the tangible aspects of having a place that is safe
Mm-hmm.
at home and having
Mm-hmm.
access to healthy food, which is our essential needs element. In a lot of cases, what we have found is these kids are providing income to their families, and so therefore they might not be going to school.
Mm-hmm.
And so then you've got education success. And we know that if you're a low income family, your chances of graduating from high school with a plan for the future is only at 68%. So that is an economic impact issue to our community. It's an issue for that individual, it's an issue for that family. So that clearly is something that's important to United Way. When you look across our state, and Jaquie can talk to this better than I can, but we have 434 people per every one mental health provider in our state. So if the kids are having issues and if we're identifying ACEs, then where do they turn for those services? Which is why we always talk about how it's important that when you think of United to Thrive and United Way's work, you might be anchored in one specific area that is of importance to you, but they really are interlocked and instrumental to shore up each other because no one experiences any one element alone. It's always intersectional.
Mm-hmm.
And Bridget, when I think, or when most people in our community think of Big Brothers Big Sisters, your organization, you think of one-to-one mentorship.
Mm-hmm.
Why is that relationship model so powerful, and what changes when a young person believes that they truly matter?
Hmm. Oh God, the skies open up and the sunshine comes
Hmm.
through.
Love that.
Not to be figurative, that's literal. If you think about the effects of um not feeling worthy, not feeling valuable, not loving yourself, all you can think of is a dark cloud in someone's mind, right? Well, think about that being amplified in the life of a child, somebody who's innocent, and just wanting and needing those natural, basic human factors to contribute to their growth and development. Um, the one-to-one mentoring allows them to be with someone who is consistently there, who's going to show up, who's going to have presence, and who is going to pour into them that they matter, that they are enough, that they have value, show them respect, and also expose them to what's possible. And then all that together giving that child, that young person, that teenager, that young adult the audacity and the opportunity to dream beyond their own personal circumstance. It allows them to see beyond. And because of that, that is why mentoring is so critically important, and not mentoring from a professional sense, mentoring from a human being connection sense. That's what youth mentoring is all about. That's what it is grounded in, is building that connection and that powerful relationship despite what may be going on right here in my household right now, despite the struggles I may be having in school right now, I know I have that one person who I can call to say, hey, I had a bad day. Can I talk to you about it? And they just sit there and listen. Don't try to offer solutions unless they're asked, but let them be seen, let them be heard, let them be understood so that they can say, finally, somebody sees me.
Thank you for creating that space. I have the smallest glimpse of it. I know you have to, Jaquie, through the Saturday mornings at the I Am Enough sessions with your young women, and those have brought some of the most sunshine into my life too, just being a small part of. So thank you. So back to the plan before we close with kind of what brings us hope. Mary, the plan to reduce violence was launched in November of 2024. Where are we now with the implementation? And then Jaquie and Bridget, what changes have you seen through that implementation that we haven't discussed already?
So, like with any plan, you launch it, and we worked on it for 18 months, but then it evolves and you learn things differently. And so, as Jaquie mentioned earlier, we've hired a project manager, Tone Roddy, who has been great to engage with nonprofits, to engage with those that are closest to those kids, to look at what we might be able to do collectively to move forward. He's only been on board since about June, but I think there's been a lot more communication one on one and understanding organization to organization about how we might be able to complement each other and not compete with each other. And so I think just as it took 9 months for us to gain alignment and putting the plan together, it might take some time for us to study ourselves and understand what roles we uniquely can play, and we don't have to play all of them, which I think is a great benefit to the community. So he's done exceptional work to date. He has been working under the leadership group with which both Jaquie and Bridget are on. We have about 12 on that, and so that continues to go. And then we've also just started convening a group that we're calling in the trenches, which are those individuals that have direct relationship with these kids. And I think that's going to be, we'll see great benefit from that, because we need to have that group coming together so that there's better communication when something does happen, which inevitably something will, but we hope we're better positioned as a community to respond.
I'll agree with that. And Mary just mentioned the trenches. So yes, the trenches have been very active. The trenches are folks that have been out there for years, trying to address that with resources and means that they need. And if there's one thing that I could say, um, funding is a factor. These folks are putting their lives on the line in some cases, in many cases. It's not just about the time that they're spending, it's also about the sacrifices that they're making. But they are even looking at different ways of being able to truly make a dent in the youth violence trajectory. And so continuing to have those conversations, finding effective ways of communication, simply because all of these situations, like I mentioned, are different.
All different.
All of the drivers are different. There's no trend in that as to how it's happening, why it's happening. But it's starting to rear its head again, just with what we've seen over the last month, last 30 to 45 days. Um, and the the it as the weather gets warmer, there's more opportunity for these interactions. So high alert is on right now, I will say, for the trenches. Like Mary, like Jackie, I'm connected with the trenches to be able to understand and know so that we can intercede and I can just do my part. Um, and if that's just bringing us together to say, okay, what's going on? Who's involved? How significant is the impact? What do we need to do? How can I help? Then that's what we're doing. So the work is continuing. It's not stopped, but it's being done very strategically, tactfully, and um very intentionally.
And what brings me hope is that these conversations, thank you to Bankers Trust for allowing us to talk about an issue that during my days on the Des Moines School Board a few years ago, a few years ago, we're primarily centered on Central City, Des Moines, and now we're concerned about our community as a whole: Johnston, Urbandale, Jaquie. The gun violence is not limited to any zip code
Absolutely
in this
not.
community, and so the fact that we can talk together as a community about ways that we can support each other in the various and the unique roles that we play to bring hope, as Bridget says, to a young person who may be struggling no matter where they are,
Mhm.
or who what caring adult is in their life, that we can be there to support them.
Mhm. And I too want to give kudos to the different sectors of the community that have come to the table and not just sat there and listened, but said, I want to get involved. I want to help. What do I need to do? But taking the time and being conscious enough to say, this isn't a world that I understand. Help me understand it and then guide me, direct me on what my role can be because we got to be led by the ones that are closest to it.
Mary, what gives you hope? Close us out.
This community just gives me hope, with all of the critical community issues. And it was said earlier that we've had many attempts at youth violence. And we had several people in these meetings that said this feels different.
Mhm.
And so I have hope that this time, with us collectively coming together to try to address it, it gives us hope. Gives me hope. I would also be remiss if I didn't say I hope people go to the United Way of Central Iowa website to Safe and Thriving Youth. They can see the report. They can also see some of the data. To the point made earlier, this is not an urban issue.
Mhm.
So I would encourage people to do that and learn a little bit more.
Well, today's conversation reminds us that youth violence is not just about individual choices. It's about the environments we all create, the systems we build together, and the opportunities we provide. When young people feel safe, connected, and valued, outcomes change for them and for our entire community. Safe and Thriving Youth is about more than preventing violence. It's about creating pathways to belonging, purpose, and opportunity. I'm so appreciative. We've learned so many things today, but I'd like to call out the importance of creating sanctuary, understanding that youth violence is a public health crisis, working on how we complement each other, not compete with each other. Start asking what happened to our youth versus what's wrong with our youth. And just making sure we always keep the youth at the focal point of the work that we're doing. Thank you for all of those insights. I just learned so much. Listeners, if today's conversation inspired you, consider getting involved, become a mentor. We heard about the importance of
Amen,
mentorship.
amen, amen.
There are lots of youth waiting. I know, especially men. It's hard
Mhm.
to get enough men to step up into
Mhm.
those big brother roles. Support youth serving nonprofits. We learned that funding is a critical piece of this. Advocate for policies that expand mental health access and youth employment, and learn more at unitedwaydm.org/youth, where Mary explained where we can find a lot of great resources and information. So thank you, Mary Sellers, Jaquie Easley McGhee, and Bridget Cravens-Neely for your leadership and for your partnership and for all the insights that you shared today. I
Thank
appreciate
you.
you all.
Thank you.
Appreciate it.
I'm Emily Abbas from Bankers Trust, and when we come together around a shared purpose, we don't just respond to problems, we build a community where every young person has the support and the opportunity they deserve. Join us next time for part 2 of our Safe and Thriving Youth series, where we'll take a deeper look at the role of mentorship, but also summer employment in violence prevention.
Mhm.
And we talked about as it gets warmer outside, those are critical moments. And we'll talk about how summer employment really drives into that. Thank you for listening. Please encourage your friends, family, and coworkers to listen as well.